Hey guys, it's your favorite sister here. It's not JJ, it's Natalie. And we are here with my favorite brother, Todd Keitz, for the Caregiving Youth Hidden in Plain Sight special series. Todd, I am so excited about today's educational episode.
I'm right with you, Nat. This has been a long time coming, and we're really excited to be here to talk with Marvell and Toni about this important policy topic.
Policy sometimes people think is not really sexy. Honestly, it's like, oh, we're talking politics. I'm like, and it's really hard to make change, and people can feel really overwhelmed by the idea of how do I make regulatory change, and I don't really understand three-branch process, and like people are like, I don't even know what that means, and so I think we have amazing panelist guests from Marvell Adams and Toni. I want to make sure that I do not Gingerelli. Is that right, Toni?
Yep.
Yeah, man. Give myself a high five over here. From Marvell from the Community Action Caregiver Action Network, and Toni from the National Alliance for Caregiving. And so, Todd, I'm going to go ahead and introduce our guests, give a little bit of background about them, and because they're powerhouses, and I don't want to delay. I don't want to waste time people yipping lips and me flapping. So let's get started. Friends, Marvell Adams with the Caregiver Action Network is a highly skilled, I love that in your bio, is highly skilled. I love that by you.
Oh, yeah.
Advocate, He is highly skilled. I can attest to that. Advocate, educator, and leader. He has a lifelong commitment to serving caregivers, marginalized communities, and older adults. He has shown dedication to serving caregivers. I love this since high school, and now it makes sense because I think you were a youth caregiver, and that you showed dedication to serving caregivers. You became fascinated with Alzheimer's disease while completing a biology report. That's really interesting. That's really actually interesting. You know what? Ninth grade's very, instrumental in lives. So, but throughout your 20-year career, you have been committed to serving caregivers and older adults. And you, in Marvell coaches and practices, highly trained dementia skills, which is fantastic. And then, of course, you have an extensive understanding and teaching the perspectives and needs of persons living with dementia. So that is very near and dear. I love that you, diversity, equity, inclusion, belonging, and accessibility are central themes, and that all speaks to my heart. It's what he believes in, and he dedicates himself to fostering equity in caregiving for all. And I am all about being some inclusive friend. So thank you, Marvell, for being here. And Toni Gingerelli, she is new to the National Alliance for Caregiving, but she is not new to the scene. So I'm going to tell you, Toni is the Director of Policy and Advocacy at the NAC, where she helps guide the organization's work to translate research into policy action on behalf of the 53 million unpaid family caregivers. Toni oversees the operations and advises strategy on Act on RAISE, a national campaign focused on accelerating implementation of the national strategy to support family caregivers. If you don't know what that's about, you need to know. There's a lot of recommendations. It's very impactful. Toni's going to give us the 411 on that, and really excited about that. Toni has an extensive background in policies and making change, and she is also a huge advocate for gender equality. Love you too, Toni. Thank you. So happy to have both of these folks. And then Todd, we were supposed to have Rita here with us.
We were, and unfortunately, Rita's had a family emergency this week and can't join us. Rita is responsible for policy and legislation. She's a lobbyist for AACY, the American Association of Caregiving Youth, which I'm grateful to be a part of on their National Advisory Council. And so they are, they're an organization. They were the first organization that was involved in caregiving youth. And it's great that their time has come, all the time and effort that Connie Siskowski, who was a 2012 CNN hero.
Wow.
And it's awesome that the time has come for this. And I'm so glad to be here with Marvell, Toni, and of course, you, my favorite sister.
Oh, thanks. Well, let's jump right into our questions, because now that we know we brought the best of the best, it's time to let the best speak. Todd?
Yeah, absolutely. So let's touch a little bit. We know what we know, but we don't know what we don't know, as the saying goes. And when you talk about it, there's the last research that was done it says that there's 5.4 million caregiving youth in this country. We know that number is significantly larger, significantly. And so when we consider that, we have to start looking at how do we use the insights from the current data and thinking about that it could be larger. So what do we know about youth caregivers based upon the current data? We know a number, and we know through what we know in our organizations with AACY. But here's a question. I'm going to ask Toni this. How does the information that we do have, how does that shape our understanding of their needs and the challenges they face?
Yeah, that's a really great question, Todd. So that number for the 5.4 million youth caregivers actually was estimated by Caregiving in the U.S. in 2020, which was a joint report with the National Alliance for Caregiving and AARP. And we're really excited that we're working on our 2025 report, which will have some new updated numbers on youth caregivers. So be on the lookout for that. With what we do know, and again, there's very limited information. This is something that is also recognized in the national strategy to support family caregivers. We know that for youth caregivers, there is an impact on their education. There was a recent report by Johns Hopkins by Assistant Professor Catherine Miller that showed that youth caregivers are less likely to be enrolled in school and have significantly less time on educational activities, which could have long-term implications. We also know that youth caregivers experience poor mental health outcomes than their non-peer caregivers. But I also wanted to emphasize that being a youth caregiver positively impacts folks' lives in many ways for the individual, for purposes of management of life skills and as well as finding purpose, all these different things. But the reality is that we need a lot more data. And part of the work that we're doing with NAC is around data advocacy. How are we really pushing forward, showcasing the need that we have for increasing the data around youth caregivers? Because at the end of the day, data informs a lot of the policy. What we can do right now is bring in youth caregivers' voices to the conversation, whether that's bringing them to the Hill, which we've tried to do with NAC, or helping them in their, building up their leadership capacity at the state level and finding other ways to involve them to help inform the conversation.
Yeah, I think I'm super excited to hear about the 2025 report because I think it's going to be, I know that there's numbers to saying that I think by 2030 because of the baby boomers retiring. And that's the focus is on the baby boomers because they're retiring at 10,000 individuals per day. And it's estimated that we need 75 million or so unpaid caregivers to supplement them in addition to the healthcare system. That study, though, came out, I'm assuming it was done in 2019 or so, Toni, 2018, 2019, pre-pandemic. So we've added on, a slight 4 year pandemic and the after effects of it with long COVID, people are having to take care of more people. Are you all, this is my own personal question, it's not even on the list. Are you thinking you're going to see an exponential jump so that 2030 number might be really reflected in 2025? That need is so much higher right now?
Yeah, that's a really great question. And what we know is, we do this report every 5 years and we see an increase in the amount of family caregivers every year. And we've seen since our last report, 5 years before 2020, there was an increase in youth caregivers, and we imagine that trend will only increase. I think the other thing is that there's been more of an awareness about, what caregiving is and self-identifying as a caregiver, particularly after COVID. So I imagine that it's likely that there will be an increase as well in terms of, the amount of people who self-identify and really think about the activities that they're performing on a daily basis to support someone, whether it's someone who's aging or has a chronic condition. So we're really excited for that 2025 report.
Yeah, I have a question about that. It's really important when you talk about self-identification as a caregiver. I mean, I know myself, and I didn't identify as that as a kid. It's just what I did. I helped my uncle, I helped my grandparents, and how will the data, how will this be reflected in how the study's being done? Because who's answering it? The kids aren't necessarily answering these questions, are they? Or if they are, how are we helping them identify as youth
Good
caregivers?
question, Todd. Good question. I feel like the Family Feud. I'm like, good question.
Yeah. So this is a national surveys that's done, and the estimates are based on households. So for example, we don't specifically ask people, are you identify as a family caregiver, but we ask folks like, have you assisted someone with X, Y, or Z task on a daily basis? Just because self-identification is so much of an issue. And then from there, we're able to assess that based off of, estimates from, the household in terms of like how many, children are in the home and things of that nature. So our research team could definitely, I think that'd be a really interesting conversation to have with them about caregiving in the U.S., particularly when 2025 comes out, about how all of those numbers are calculated. But they're based on estimates from the amount of adults that we had filling out the survey.
Right. So it's the adults who are filling it out. So perhaps they're not seeing their kids as youth caregivers. So that's where the number, I'm very interested how that gets covered.
Yeah. And, one thing I will add real quickly, because I think it's important is, I know we're going to talk about your policy solutions, but I think it is important that we're asking youth themselves, right? And, Connie at AACY has, been able to do a little bit of this in Florida, but one of the things that we can look at is, using school health assessments, right? So these are assessments that help to identify strengths and weaknesses of school health policies and programs, and kind of provide this snapshot of what's happening for students in the school system. And, having a question about youth caregiving, how do you help someone at home with X, Y, or Z activities to help, inform the conversation and provide schools with the information they need to be able to actually be resources to youth caregivers is, I think, a great place to start.
Is my understanding correct in that that's one of the challenges, is to get schools to actually do those questionnaires or get the kids to report on those questions? What are they doing at home for family members?
Yeah, I think it varies state to state and district to district, so I can't speak for all the schools. But, I think it would be, that's something that can be discussed with school boards or within your school district to help add that question to the questionnaire. I think it's, definitely tough. A lot of things, happening in schools. There's a lot of, shifting priorities and things like that. But I know a lot of schools are already doing these assessments. So adding another question, I think, is something that would be considered a reasonably easy lift, especially, with some advocacy.
Yeah. Marvell, I saw your mind going.
Yeah, I saw Marvell's mind going too. I want to let Marvell. Hey, Marvell, come on in.
Yeah. No, because it clicked in my head that the other piece of this, because I had a friend in high school that it didn't dawn upon me until this conversation really should have been seen as a caregiving youth. But here's why: his mom had cancer and several bouts, couldn't work, and he worked overnight and was sleepy. Would fall asleep in class all the time. And the reason he went to work was because his family needed that income. And even though he was not physically hands-on direct supporting his mom and the household, he was bringing in income because that's what the family needed. And so, it just kind of occurred to me that, like, whether it's a conversation now or not, but soon enough, that's another aspect of this that we probably don't talk about as much as we should, because, again, going back to my own personal story, my mom, she dropped out of high school when she was 14 after her dad passed away, because to take care of and to work. And, how often is that happening, where school-age kids are neglecting their own educational opportunities, for being a caregiving youth, and that can have a huge, wide scope of definition, whether it's doing actual care, doing things around the house, or, quite frankly, contributing to the finances of the household, because that's just as much of a need and a void that happens when someone's, a care recipient potentially.
Yeah.
I will tell you this. I want to say this. I'm going to jump in. And working in the mental health field with children and families for 25 years, truancy. Like, how many of our youth caregivers are labeled as truant? And a lot of children come into foster care due to truancy. And I'm sitting here in my mind, when you said that, Marvell, I thought of one specific case of a young man who comes from a Hispanic family. mom is unable to work. He was working, and the school was like, well, he's true, and the mom just needs to get a job, and she needs to think about this. And we knew that there was a health related issue, but he got into the juvenile justice system. Like, we're putting these kids, because now you're truant, and then some of these truant kids come into foster care. And I can tell you, social services in any state's going to say, we can't manage truancy. Like, we can't. So that, I wonder, and I can tell you that our forms, like our government forms, don't have the right boxes to check to say, is this child a youth caregiver? Are they a caregiver in the home? And what does that look like? Because I had never thought about money, like not like children going to work, money.
No, and that's a great point you make, Marvell. And tying it to what Toni said about on one hand, they're gaining skills. They're gaining skills in management and so on and so forth. But yet, perhaps at the detriment of their future life, because if they're not getting the educational opportunities that others are getting, well, their hiring is going to be hard.
Well, and how many of this, and let's talk about discrepancies in race, because we know that the cost for caregiving based on race is exponentially higher for Hispanics, for our Black and brown friends, basically. Like I think it was AARP had about $7,250, give or take, is about the annual cost of caregiving for unpaid caregivers. And I think that jumps to between $11,000, $12,000, give or take, for individuals, are non-Caucasians. I'll just leave it super wide open, non-Caucasians. And then you have access. And so it also means that they're going to have a harder time with mobility and breaking poverty. And so I think, I'm like, ooh, I get hot on this. So I think this is so important. The study is so important that NAC's doing. And then, because I'm going to call out my friends who are superintendents, the school board members, like, guys, we need the education system to jump on so that we can really identify. Because Marvell, I know that you guys have a help desk. Like, I'm thinking about like this, the NAC is heavy in policy, and you guys are all like a different type of help. And I want you to kind of jump in on that. Like, how can the help desk, and what are some of the things that you guys are doing to support each other? Because I know you guys are supporting each other's work.
Yeah, and so that's one of the things, our help desk, which is more than a help desk,
I know,
so
right?
it's, folks, if you right now or after you listen to this podcast, wanted to call 855-227-3640, or you could go to our website, caregiveraction.org, where you can do a web chat or an email, so, multimodal in the way that you can engage. But the whole point of it is, we say to folks is that if you're a caregiver, call, period. Reach out, period. It doesn't cross the lifespan. Don't ever think to yourself, and we have this all the time, well, I'm not sure if I'm a caregiver. It's like, look, if you ask yourself that question, you're a caregiver, period. I don't know if anybody, I've never found an instance where a person went, I'm not sure if I'm a caregiver, and anything they said after that was anything but absolute caregiving day in and day out. And so when we offer up these resources, and essentially it's a point of entry for folks, where if you're not sure where to start, if you're a youth caregiver, if you are a long distance caregiver, if you are going through your third, fourth, fifth, 10th episode of caregiving, we have one of our board members whose mother has MS, and our board member has been a caregiver for more than half her life.
Wow.
For her mom. So you can imagine that the number of episodes, the number of different situations that come up really can lead people kind of back on their heels. And so what we say to them is like, give us a call, because sometimes you may discover it's just a conversation and just to get something off your chest or to get some mental health support. Yep. Sometimes it might be recognizing that your local AAA is doing something different in Sacramento than they are doing in Denver. And so we can help you, guide you to that, but understanding that you are not alone. And so really having the absolute understanding that self-recognition is a big part of this, because as we all know, half the people out there that do some sort of caregiving role or responsibility do not recognize themselves as a caregiver. And so from the RAISE Act and from the national strategy, understanding that self-recognition is a huge part of that first phase of making sure caregiving is on a larger scale. But from our health desk perspective, we really do partner and figure out ways with our team of social workers to support individuals and have them understand, look, thank God you called. We want to help you as much as possible. Call tonight, tomorrow, the next, whatever you need to do, because from our perspective, if we can provide them with resources and enable them to be connected, not just to resources, but to others, to local support groups, to online virtual meetings, then they are more equipped to be not only great caregivers, but definitely as equally as important is that they also are being reminded and encouraged and guided to take care of their own selves. Because without doing that, and we all know this, you get on a plane, what do they say? Put on your mask before you put on the mask of your child or someone else. And it's the exact same scenario that if you burn yourself out, and if you're a youth caregiver, I mean, think of the stuff that piles up. You're talking about school, you're talking about being a caregiver, you're talking about all the stuff that happens regarding homework, extracurriculars, and teenaging. Being a teenager.
Hard. It was easier when we were
it.
younger, Marvell. It was easier when we were younger.
There was no record of it either.
Oh my gosh, ain't that the truth? Woo.
Yeah. So it's just, there's all those aspects of it. And being able to have this resource for us is really being able to say to that 16-year-old who's working overnight to be able to support the family that, one, you're not alone. And that there is help for you, even if you think, as a 16-year-old with a mom that has younger onset Alzheimer's, that there's nobody on this earth that is similar to you. Guess what? There unfortunately are a lot of individuals that are in similar circumstances, but the thing that's even more similar is them not recognizing that they should and could be reaching out for help.
I'll say this. One of the things, because, Toni, you mentioned this, and this was my perception going into this. I was so concerned about having youth share their experiences and it be very triggering and that it was going to be very traumatizing. I'm very much a trauma-informed care person because I'm a social worker by trade. And I'm always, the questions and how we structured them were trauma-informed. These kids are actually they were the opposite of what I would have thought they would have been. A lot of opposite, because a lot of people think they're going to have mental health issues, they're going to have truancy. And so those kids absolutely exist. There's a lot of them, okay? They're also very well hidden. I think the other really hidden kids are the overachievers. So Kaylin was just on. I can tell you when you hear Aditya from Cares Trust, he's from the UK. This kid, I'm going to tell you, I'm like, he could run for prime minister. He's already presented before the House of Lords. The girls from, the young ladies from Canada, the girls from Australia, these kids are the most overachieving kids. And that's the other side of it. And that's still a mental health piece too. Like, let's be really clear. Just because the kids are doing really well in school and, they're not having any behavior problems and they're doing it all. Those kids, the ones, think about your educators. You spend your time on the kids that are giving you problems. And
so true. And you think about just in general, think about the expectations on those kids, expectations of kids who are overachievers just in general, but those who are also caregiving youth, just think about that and their expectations. They don't want to disappoint anybody that are going on. So the challenges of that, we could get into a whole other rabbit hole related to mental health, suicide, exactly, related to that. But it's a great point, Nat.
Well, I love this. Heck, this could have been the whole policy thing. But there's some more questions to ask. I'm like, oh my gosh. I got to be mindful of my conversations. This is so good. Okay. So data is so important because it informs what we do, our policy, and it informs actually where dollars are put. So thank you guys for collecting that data. Let's talk about policies. So Toni, you mentioned there's a whole bunch of cool acronym strategies because the president has been putting out stuff. He put out, I think it started about 2 years ago, and they've just been putting out things for caregivers in general, so national strategy around that. But then you've got grandparents and kinship because that's where it starts crossing over into foster care and mental health. So why don't you talk about some of the national strategies, some of the politics, the policies that are being put out? We'll talk with both of you guys about how you guys are responding to that. But Toni, why don't you start?
Yeah, absolutely. So I think to start, it would be helpful to give a little bit more background on, the national strategy to support family caregivers. So the national strategy was developed jointly by advisory councils created by the Raised Family Caregiving Act and the Supporting Grandparents Raising Grandchildren Act, and with extensive input from the public, including family caregivers, the people that they support, this strategy was created. And it's essentially a comprehensive analysis or comprehensive roadmap of how to better support family caregivers, and it represents the first time that the federal government has collaborated with the private sector on a response to this long-standing national need for a comprehensive system to support family caregivers. So within the national strategy, there are nearly 500 actions and 350 actions at the federal level, which is some of the work that NAC is actually focused on with our Act on Raise campaign, which is a campaign that brings together nearly 120 campaign partners to move forward implementation of the national strategy and also help inform the next iteration. So one of those things that we've really tried to focus on is, also making sure that diverse voices are at the table. And I think the first iteration did a really great job with this. But wanting to drive that forward even more so, and particularly with youth caregivers. If you read the national strategy, it talks about how there really is a lack of data out there for youth caregivers, and gives some recommendations. But thinking for our next iteration, how do we make sure youth caregivers' voices are included even more so? Does that mean on our non-federal, for the non-federal advisory council members, maybe there's a youth caregiver that's included to have their voice on the council, and really thinking through what are some other ways to make sure we're inclusive in the work that we're doing.
We got a couple of names probably could recommend.
Yeah, I was
Marvell.
thinking. Yeah.
I got a couple of names. Marvell, how about you guys? What are your thoughts on those legislative landscapes, especially around the strategies?
Yeah, I think the national strategy is a holistic view, and it really provides us with this framework that if fully realized, and that's kind of the thing with all, kind of always with legislation, if fully realized, can truly make great strides in making caregiving not only at the center of the commentary in all facets of lives and work and personal lives, because it really is all facets of it. And every generation is seeing this, so the boomers are seeing it, the sandwich generation, the Gen Xers are seeing it, but, being it with kids that they have a responsibility for, older adults they may have a responsibility for. We just talked about kinships. But the other piece of this that I think that still is on that edge of needing a heavier push is how do we more creatively provide that financial support, because right now you're talking state by state, perhaps, where you've got certain plans that are able to provide that financial support for caregivers. Okay, that makes sense. How do you open that up to caregiving youth? And how do you get over, that stigma? It's like, well, you could make the argument, well, they're youth, that why would you want to, compensate them? Well, they're doing the work. Right? And how are we in ways recognizing that caregiving youth should be getting, school credit? They should be getting volunteer hour credits. They should be getting some sort of financial support. They should be receiving some sort of guidance around educational opportunities that maybe if they find that caregiving is something that really speaks to them beyond just the sense of obligation they may have, of being able to have a career path that they can start in their teens, which God bless America, being able to do that is just a gift for, I think, a lot of folks. And so recognizing that it really is groundwork that the RAISE Act and the National Strategy has set. And so fully realizing that is a big part of our work. But I think also recognizing that as long as we have kind of this really patchwork across the country that is more state specific in many aspects of caregiving, we're still going to have this patchwork of services and abilities and gaps and voids in really need that's going to be there, and the demographics, even though they're changing dramatically on a national level, when you look state by state, you can see that some states are really being left behind in a lot of different ways. And so how do we really try to find ways to innovatively catch up? And, we believe the Caregiver Action Network is that part of it is being able to understand and listen to and hear from caregivers on a day-to-day basis. And so when you're talking about legislative and policy objectives, and I know NAC is so spectacular at this, of bringing the caregiver's voice into that conversation and being able to recognize, okay, I'm not just talking about, Congressperson X and talking about this national strategy. I'm talking about, we were talking about, votes earlier. Your constituents are caregivers. I don't need to know what district you're from. I don't need to know zip code they are. Your constituents are caregivers. And so if that's the case, when we go to the Hill, we can rely upon our friends at NAC that they really are educating legislators on policy, on legislative. So when we go to the Hill, we talk about, okay, this is Susie Q. She lives in your district, and her mom has Alzheimer's, okay? And this is a virtual reality program that we're utilizing to educate her and her colleagues around understanding what it's like to have Alzheimer's disease. And this is why this is important. This is why the Older Americans Act is important, reauthorization is important, and to really drive it home. And yeah, as we all know, 9 times out of 10, you tell that story to a staffer in a Hill office, and they have some sort of connection to caregiving, either that's tangential, or many times they themselves have. Many times the elected official has been in a caregiving role, because many of them are in that sandwich generation and older and boomer generation. So there's so many aspects of this that's what I love about the strategy, is that it really is a roadmap, of our abilities, but it's that ability to deliver on it. And as we always know, funding. You have to appropriate for it.
To say, "Oh, we need some money."
You have to appropriate for it every year, and you have to recognize that without that consistent support, you are taking away support that is needed. And we also make this case: who do you think's helping keep rehospitalizations or hospitalizations down? Who do you think's helping with compliance with medications being taken? Who is the individual? The doctor writes the script. We got lots of regulations and things that are around that. The pharmacist fulfills it. Lots of regulatory support around that. But who picks up that prescription? Who makes sure it gets delivered and taken at 8 p.m. as well as 8 a.m.? Who makes sure that there's supplies and there's needles? It's the caregiver. And so without that support, and recognizing the need for 75 million unpaid caregivers, like think about that statement, that our country needs 75 million people to go unpaid in order for our health system to function.
Yes.
That's a pretty shocking number, right? Yeah. And so recognizing that and being able to make the case to legislators through policy that this isn't about pork barrel politics. This is not about, writing in legislation that's just like a razor sharp devoted towards a certain constituency. This is pervasively affecting the fabric of the U.S. and our ability to really thrive, because we need caregivers in order to support and also, quite frankly, ensure that individuals that want to and can remain independent longer and contribute and be productive can do so with the assistance of perhaps a care circle around them.
Yeah. And I also, if I could jump in to add, these are such great points, Marvell. And, there was a report from AARP that said that, estimated nearly $600 billion. That's the value of family caregivers.
Our work.
Yes.
I think that's undervalued, because my rate of pay per hour is a touch higher, Toni.
Yeah, you definitely got to call them up and let them know, Natalie. But, I think one of the things that's so important is, we talked about stories, but bringing caregivers, one of the things we've did last year is have an advocacy day for Acts on Raise. We brought out over 50 family caregivers and advocates to meet with over 75 offices to share their family caregiving story and talk about how the national strategy has directly impacted their lives or their care recipients' lives. And, Marvell hit the nail on the head. Time and time again, we, had caregivers come out and say, I talked to the staffer and they talked about their family caregiving story, or they talked about how their representative, cared for their parent with Alzheimer's, right? And those stories are so, so powerful. And making sure that youth caregivers are in those conversations, I think is important too, whether it's making sure you can fund them to come for the fly-in days and things like that. We had one former youth caregiver who's just been an incredible advocate, who I think is actually now on the board for AACY, Todd, Maria Miranda, who has just, has been such a wonderful advocate and really, put our feet to the fire and saying, what are youth caregivers included in this conversation? Have you thought about the policy lens from this for youth caregivers? So
I like that. They should hold us to the fire. That's how we make change, if you think about it. And that's how, because if we understand, then we can go and we can hold other people to the fire. Our elected officials are the people who are responsible for writing legislation that represents our needs, everyone's needs, not just your policy need or your political side need. So caregiving is the most neutral, bipartisan. Let's be friends.
Absolutely.
We don't see Democrats and Republicans in caregiving. We's all there. And so I think that's the biggest thing, and I think resource behind it. I want to, Todd, let's move us, because we've had such fun.
Yeah.
I feel like we need like 3-part series on this one. I feel like one thing I want to mention again, because I'm going to come back and hit my friends at the Department of Education. I want to know how much the Department of Education on a federal level, on a state level, are coming into these conversations. Just because, Marvell, you just kind of caught my attention in what you and Toni are talking about. I really think, interagency collaboration. We've talked about on a state level. Look, friends, this is a problem on a local, state, and federal level. Getting agencies to work together, because they all have their mission, but they also have their own language and charges that we're responsible to. Anything that you all have seen where you've seen some really good interagency collaboration amongst the agencies, whether it's ACL hanging out with DOE, and I give these acronyms because that's the Department of Education, so guys, and so ACL, the ACL is give me the full name because it's Community Living.
Administration for Community Living.
Thank you. It's not really obvious for me some days. I'm like, it's
I
administration.
get stumbled on it many a time. Don't worry about it.
I appreciate the grace on that one. So any interagency collaboration that has you guys jazzed that you all are a part of? And it's okay if you don't know of any, like right off the top of your head, because it's hard to get the entities to.
It's a phenomenal question, and it's a question that that unfortunately probably doesn't have a ton of like a response on it. But I will pause and let my good friend Toni go because I'm really not coming up with anything.
And that's okay. Yeah. I mean, it may not. Go ahead, Toni.
Yeah, so I think one of the things. I think the national strategy is a great example of that, right? And I think that there's more that, we definitely can do. But, think of it this way. The Administration for Community Living really oversees this entire process. And, every few months they have a public RAISE advisory council meeting, and they'll bring together. So just for a little bit more background, when I say this RAISE advisory council, there's non-federal members. So those are family caregivers or those with family caregiving experience. And then there's federal members, right? So each of the federal agencies that are included in the national strategy have a representative that comes and reports out on what is happening with the national strategy. So I think that's a really great example, and I think it's where the Administration for Community Living has done really a wonderful job in terms of leadership. I think there's definitely more opportunity to figure out, how we can cross-pollinate some of this work. But I think that is a really great example and can be kind of an example at the state level, right? We work with a lot of state advocates who are like, how do I make sure that, Department of Labor is talking to Department of Health? And I think this is a model that can be implemented at that state level.
Good points. Well, and I'm working with a AAA out of Richmond, Virginia, who is trying to figure out, there's some legislative changes, and there's the grand families and kinship initiatives, and they're trying to keep kids with families in the home setting and at all costs. And so, and I support that. Like, we've got to support our grand families and that sort of thing. But some of these kids will be caregivers potentially for these individuals as well. We have to recognize that. But they're trying to figure out, hey, we need to bring social services on the child side and adult services. We need to have them cross over. And who do we bring to the table? How do we bring to the table? So I think you're right about the national strategy being a good example of, can we bring people to the table, and can we start getting a universal language where we all can agree on, so that we can start moving forward? Because I think that lack of universal language between government entities and the non-government entities, I think that can be hard if you think about it. So, all right, well, let's move along. We've got a couple more minutes. Okay, wait. Todd, is there anything that is burning all over you right now?
Gosh, great.
I like number 9.
All right, I'm flipping down to number 9. Let me go there. So number 9. All right. So let's talk about the future direction and policy priorities. So looking forward, what are the policy priorities for your organizations in relation to caregiving youth? So Marvell, you want to start with that?
Sure. So, a big part of our policy priorities right now are around recognizing that the demographics of the U.S. are changing quite dramatically. And so you're talking about more Black and brown representation across all demographics, across all age bands, and recognizing that those policy priorities for us means, we have a system, whether you want to call it the health system, you want to call it the mental health system, you want to call it caregiving, all of those are really constructed without marginalized communities in mind, which is, kind of a typical thing when you talk about systemic isms and things like that. And so part of our push has been, how do we, from a policy perspective, and how do we, from a rubber meets the road perspective, change the things that we're doing so that we do have a revisioning of some of these policies and priorities, as well as our tactics in delivering resources and supports to caregivers that are through the lens of marginalized communities. So, for instance, we just wrapped up, and I just saw a snippet of a preview today, so it'll be live on our website next week. But we've, for a few years now, had a blueprint for caregivers of individual mental health issues. And we took that blueprint through some grant support and re-envisioned it after some roundtable conversations, really some great deep dives, to now have a complementary blueprint, this blueprint for Black caregivers of children with mental health issues. And the reason we did that is because, one, there's far more literature and recognition that Black and brown individuals, when they are engaging with the health system on behalf of their care recipient, that they are dealing with several additional layers that are making it much more difficult for them to receive services. And so recognizing that, being second guessed, not being heard, not being respected in the sense of their opinion, or being put in a certain stereotypical category, really prevents them from being the advocates that they need to be, or for the services they can reach out to. So from a policy perspective for us, it's about how do we bring equity into this space in a way that recognizes that, one, whether we see it as an issue or not, you're going to end up with, by 2040, the baby boomers will be the last generation to have a majority white population among 65 and older. Okay, so every single generation after that is projected and exponentially growing to have a much more diverse demographic. But the systems that we're trying to continue to improve upon were still built with not marginalized communities in mind. And so I think from those policy perspectives, we see a really great opportunity. But the last thing I want to say is that kind of forward-looking, personally, I think one of the areas that is going to become more and more critical for us to recognize is that the fastest growing population of homeless, unhoused individuals are older adults. And so you couple older adults being the fastest growing area of unhoused, you couple that with kinship relationships, youth caregivers, and you can see a problem that's going to start to rear its ugly head more and more, because the second fastest growing group of unhoused individuals are teenagers.
That's right.
So you've got a really interesting kind of conflation of policies that I don't think we've even thought of how to start to address yet. I could be wrong about that. There's some really good models out there, like Bridge Meadows out west. They do some really great work with kinship housing and bringing families together that are grandparents and kinships that are caring for younger adults. But recognizing that we really do have to start to think about housing alongside caregiving, because I don't know if we can have a construct for understanding what caregiving looks like for the unhoused, but it's happening. But we don't have eyes on it, and nor do we have a policy perspective that gives us the ability to address it, or even to describe it to legislators.
Oh, yeah. That just took me to church. Yeah. You took me to church on that one. Let me tell you right now, you got me fired up on the housing stuff, because housing is a real problem in the U.S. and affordable housing. So let's just make it a little bit harder.
Affordable housing.
Let's talk about affordable housing. So, okay, Toni, I'm ready. I mean, that's a hard one to follow, but I got you. I know you're on it.
No, 100%. And no, Marvell, I think it's really important that, you think about how caregiving intersects with so many of these issues, from housing to voting access to food security. And I think, a lot of times we think of things in silos, but we really need to think of it through this intersectional approach. On the NAC side of things, data advocacy is something that is, in the blood of the National Alliance for Caregiving since its founding. And the national strategy recognizes that, as of 2022, there has been no major body of work to provide information about the experiences of caregiving youth. And similarly, there's little information on the impacts of sibling caregiving. So promoting and advocating for finding ways to make sure that data is collected is something that is really important to us. I would also say that in terms of legislation, one piece of legislation that we've endorsed and are really excited about is, the Lifespan Respite Care Reauthorization Act. So for those who don't know, the Lifespan Respite Program empowers coordinated state systems to provide accessible community-based respite care services. And in the Senate version of this bill, not only does it reauthorize funding, but it updates the definition of family caregiver to ensure more individuals can access support that really reflects the diverse caregiving landscape. And part of that is the definition to include caregiving youth, right? Which right now are not included. So that's something that we're following and we think really has some potential on the national level to have some impact. And then also, in our programs department, we are working on some reports related to mental health and caregiving, as well as transplant caregivers, which are inclusive of youth as well. And then the last piece that I'll also add is we recently launched a new initiative called the Caregiver Nation Network, which is really about creating this toolkit for supporting state leaders where there's already so much happening on the ground in the caregiving space, providing them with the resources they need to kind of get to the next level in their advocacy work. And part of that includes, peer-to-peer learning and caregiving, peer-to-peer learning and opportunities around caregiving policy issues, but also elevating their voices on the state and national policy agenda.
This is good stuff. I really hope our friends at NASHP, National Academy of State Health Policy, that's where typically your government leaders go. And I know that conference is coming up. And then, of course, Advancing States, which is Home and Community-Based Services. That's a fantastic conference. These are great places, and I bring these up because there are different ways, and this is my last question, kind of as we conclude, what are immediate actions or ways that people can get plugged in? Like, how do I advocate? Because some people may say, hey, I'm not really that comfortable going and talking to my legislator. I'm not really sure. Apparently, I have to have an elevator speech. It's like 60 seconds. So what are ways that you might say to our listeners, this is how you can get plugged in and use your voice? Marvell, any thoughts? Oh, Toni, you go first.
Oh, sure. Yeah, sorry if I cut you off there, Marvell.
No.
But
No. I'm deferring to you because I feel like I've been jumping in ahead of you. So, please, Toni, go ahead.
Oh, look at I love politeness.
We love this. We love partnership. Yeah, so the first thing I would say is, you can join our Act on Raise campaign. So if you go to actonraise.org, there's an opportunity if you hit Join Us to join the campaign either as an organizational partner or as an individual advocate. And every month we send out a variety of advocacy alerts with opportunities to sign on to letters, opportunities to reach out to your legislators. And we try to make it as easy as possible, right? And the reason we do that is we know the family caregivers are busy, right? We want it to be as easy as a template or just submitting your name to support things. So I would definitely say that's one place to start. And I would say the second thing is, call your legislators, right? You don't have to always have that exact pitch. You can talk a little bit about what your experience is. There are people at the offices who are there to listen. I, was the chief of staff for a state senator for 2 years. And during that time, we would get calls all the time and people wonder, they're like, do people really track and what's happening? And they do. We note down when a constituent calls and has, see if there's an uptick on certain issues like caregiving or like labor or workforce development, right? So I think that's the second piece. And then the third piece is I just want to give a shout out to so many of the youth that are utilizing social media to share their stories and their voice. We've seen this with TikTok. We've seen this with Instagram, Twitter. They may not have necessarily the resources to get out there to the Hill, but social media is a great way to make your voice heard. And I appreciate the youth who have been leading the way on that work.
Yeah.
Good point.
Yeah, very good point.
That's a very good point because our young little influencers know how to use their voice and have lots of hundreds and thousands of people that are following them and commenting. So, Marvell?
No, I could not have said it better. I think that being able to start with what you have and where you are is the most important aspect of this. So if you see something like Tony's, if you see it on social media, forward it to your legislator. if you are sitting there and you want to just record a voice memo on your phone and email it to them, do it. Whatever makes it easier for you, because your stories and coming from your perspective, sharing your individual story as a constituent is really what moves the needle in elected offices, period. For them to understand your story, one, it helps them to make the case, because we all know policy is not policy. Policy is storytelling. Every single time it's storytelling, at least the ones that are successfully passed, and some that don't, but recognizing that your story really does have a lot of power. And so don't minimize the fact that you may have had a good day or bad day or neutral, but recognize that being able to share that perspective brings you uniqueness to that storytelling aspect of policymaking, and being able to share that in a way that's easy for you with your legislators, with their offices, with your local city council, up and down, the ballot, as they say, is really an important aspect of it. But starting from where you are and not feeling as if it's this monumental task, but instead the story you have inside of you is really what's going to move the needle.
Well said.
That felt good. You guys are the best. Todd, I have been so blessed today.
This has been incredible. I mean, it's great. The interaction's been great. We didn't even get to some of the questions.
No, but they're so good. But you guys are so awesome, because you touched on all the little pieces that we knew we really were important. Yeah. And I think you guys are going to have blessed so many people with your words of wisdom and guidance and recommendations. So I hope if you just take one thing away today and act on it, do that. Take one thing. You don't have to do them all. If you do one thing, that's a good start. And even just showing up today and listening and learning so you can tell someone else, that's a pretty good start. So Marvell, Toni, Todd, thank you guys for being part of the Caregiving Youth Hidden in Plain Sight series. Todd, of course, with My Care Friends, who is our partner with the sisters. JJ will be so jealous she missed this one. Guys, until we confess again, we'll see you next time. Thanks so much for listening.